And as per my usual, I get very eclectic in these meetings. So I was going to start with something a little, I don't know that it's controversial per se, but as with medicine, we kind of have two schools of thought and then they kind of overlap and go back and forth. But back in the day, there was a germ theory, and there's, kind of been a re-emergence of the terrain theory. And we talked a lot about terrain and the different things that impact our own personal environment. But if you think about it, germs seek their own natural habitat, which is diseased tissue, or you can think about flies to garbage. But rather than being the actual cause of the diseased tissue. So what comes first, the chicken or the egg? So if you look at a germ caused disease, you think about, the fish being in basically a dirty bowl, and we need to treat the fish. We need to give them a vaccination. We need to give them a medication. We need to give the fish something, as opposed to a terrain theory where really we just need to clean the tank. And if we clean the tank, those fish become healthy. I talk about this all the time. If we break an arm and we allow it proper terrain, we heal that break. If we get a cut in our skin and we give it the proper terrain, we will heal the skin. We don't necessarily have to give it a medicine or something like that. Our body is actually innately attuned to heal itself. So I like to even look at chronic diseases and cancer from that same terrain perspective. And how do we improve our own terrains? Well, I've given this slide a number of times, but I always say first, remove the toxic foods from our diet, which are sugars, grains, vegetable oils, processed and packaged foods. And then we go the next step, decreasing carbohydrate below our own personal tolerance. And everybody is going to be different. Some people can get away with just a lower carb diet. Some people need to be very strict. Depends on how dysfunctional the pancreas is, how sensitive their insulin response is to those carbohydrates. The thing we can't forget to do is take in adequate protein. Protein builds our lean mass, including our bone structure. That's a protein matrix, as well as our muscles. Muscle density or muscle mass. Lean mass is associated with longevity and health, and has even been associated in multiple cancer studies to increase outcomes in cancer patients. And we say don't be afraid of fat. So fat that comes within food naturally is good for you. Food that is refined from things that don't really have that much fat. So if you think about soybeans and corn and quote unquote vegetables, which are really nuts and seeds, they don't extract fat very well, and they have to be done by a chemical process. But when we're eating fat that comes in meat, in eggs, in avocados, in olives, or the cold pressed oils such as olive and avocado oil, those are good and healthy fats. And then we can take it to the next step, which is really doing the deep dive in your own terrain. So how and when do you eat? So there's light and dark cycles, time restricted feeding and intermittent fasting, doing different types of exercise. A short HIIT exercise is better than kind of chronic cardio. Doing lifting, weight lifting, body resistance exercises increases our lean mass. Getting good quality sleep. Sleep is when we repair. It's when we take out the trash, improve cellular health. Checking that we're actually getting good sunlight for vitamin D and nitric oxide synthesis. And decreasing toxins. So toxins come into our environment, in the food, in the air, how we store food, how we cook food, different types of food. So one of the reasons that grains and beans, which may have been healthier at some prior time, actually really take in a lot of the glyphosate, the pesticides that are used, even if they're coming from organic farms, because glyphosate will seep into the soil, it will be in the air, it will be in the rainwater. So anyway, we really want to look at toxin impact. We've talked before about the books, The Metabolic Approach to Cancer, which goes through a lot of those. We've talked about estrogeneration, which is another book that goes a lot into things in our food and other parts of the environment that actually are estrogen mimickers. When we talk about carbohydrates, we always look for real food. We can get way more food for 20 grams of carbohydrate when we eat above ground vegetables, berries, nuts and seeds in their whole form. So nuts and seeds in their processed oil forms, not good. Nuts and seeds in their whole form, better. And we look when we get the whites or the yellow foods, you don't get a whole lot of food for 20 grams of carbohydrate. You can get a much wider breadth, and you can see here just how much more nutritious the low carbohydrate options appear, or they are. So what do low carbohydrate breakfasts look like? So steak and eggs, maybe some veggie omelet or frittata. This I thought was a really unique thing. I haven't ever tried it, but a baked egg and bacon into an avocado looks delicious. Other lunches, making salads with good proteins and fats is a great way. Making your own mashed broccoli or cauliflower and some patties. You could do little salmon patties with some extra butter or garlic would be delicious. Low carb dinners, usually some kind of a protein, maybe some leafy greens or other above ground vegetables, maybe some mashed cauliflower. But I want to remind everybody to keep omega-6 fats low. I see this over and over again, that omega-6 fats do tend to creep into our diet. And where are those from? The predominant one is from those soybean oils, and those are in everything, like even in vitamin D capsules and fish oil. I've seen it. So read your supplement labels. Look at all labels on anything. Now, granted, I usually say if it has a label, you probably shouldn't be eating it. But if it does have a label, read it. If it has any kind of nut, seed, or vegetable sounding oil, please toss it. So this was an interesting study that was published actually last year, but it looked at the mortality from coronavirus. And interestingly, it found that the mortality increased with unsaturated fat. So unsaturated fats would include polyunsaturated fats, which are those soybean oils, etc., but could be omega-3s, but we'll talk a little bit about that. But also they're calling them as monounsaturated fats. So any unsaturation, whether it's poly or monounsaturated fat. And then they also looked at the association between calcium and albumin. So what they found was that if there was a low calcium or low albumin, which is a protein, early, that they actually happen early during a severe coronavirus. So those two numbers start to decline. They also found that unsaturated fatty acids caused the multi-system organ failure and inflammation that resembled severe coronavirus disease. And when they looked at mortality, they found that the more unsaturated fat, the intake, the higher the mortality, whereas the more saturated fat intake, the lower the mortality. So even though we know that, for the most part, monounsaturated fats are better, that omega-3s are better than omega-6s, it's very likely this was predominantly an omega-6 driven thing, because that is the fat that seems to be so highly overconsumed in our current food environment. They looked and they found that unsaturated fatty acids did injure and impede cell function, that albumin binding prevents but does not reverse injury. And so if that was low, you didn't even prevent the injury. So then they showed that calcium bound the C18-2 fat, which is a polyunsaturated fat, more weakly than albumin did. But calcium is in such higher concentration in our system that both of them actually benefited this damage. So again, we'll come back to this, but that I just thought it was interesting that once again, saturated fat gets a pat on the back, and saturated fat are fats. Actually, olive oil is high in saturated fat, coconut oil, and our usual animal-based products. These are a few slides on omega-6, or trying to get you an idea of what has different types of fat. So the green is saturated fat. So as we come down into some of the dairy fats, chicken fat, lard, beef, butter, cocoa butter, palm kernel oil, and coconut oil, you can see the saturated fat starts going up. The purple is what we want to avoid. So anything with a ton of purple, we don't want. And if you look at them, they are all in nut and seed oils. And you guys can look at that. You can find that online as well. And another one that kind of looks at more of food as opposed to just oils. And interestingly, everything above that yellow line, or I should say everything below the yellow line, are all plant foods, so mostly nuts and seeds. And those include whole nuts and seeds, whereas the things above the line are a combination typically of animal, so chicken, beef, pork, salmon, as well as typically above ground vegetables, right? So the green vegetables, broccoli and romaine, and even some peas. So if we stick to a low carbohydrate diet, limiting our real whole nuts and seeds and eliminating those nut and seed oils. Sorry. All right. So the next thing, sorry, I'm going to have this terrible. I got my little neighbor boys at my front door. Sorry. Okay, so stimulated insulin secretion. So this was a super interesting study that looked at weight loss in adults with high body mass index. And what they found, or what the goal of the study was, is to test the hypothesis that insulin secretion predicts for body composition changes in young and middle-aged adults. So they were all high body mass index patients. They did 2 large feeding studies comparing a moderate carbohydrate diet versus a very low carbohydrate diet. And they did kind of a glucose tolerance test where they gave them a 75-gram bolus of glucose and looked at what their insulin was 30 minutes later. So that wasn't a fasting insulin, that was a 30-minute insulin. They found that the higher that 30-minute insulin was, the smaller the fat mass loss and the larger the lean mass loss. So the, and I might have typed that wrong, but basically if you had a higher insulin 30, you lost less fat, you lost more muscle. When they looked at HOMA-IR, which is an insulin resistance score looking at fasting insulin and fasting glucose, it's a calculation thereof. And that was, so if that is high, it means people have a higher fasting insulin and or fasting glucose typically, means they're more insulin resistant. So the higher that HOMA-IR score was, or the more insulin resistant the patient was highly associated with those adverse body composition changes. So when we want to eat, or when we want to lose more fat and lose less muscle in our weight loss, we would like to keep insulin low. And that's why a ketogenic diet does that. Again, so our goal is to lose fat and increase muscle. If you ever want to know what those are, there are things called DEXA scans, although the ones you get at the doctor's office are just looking at bone density. But if you went to, there are some private companies that have DEXA scans and you can buy a scan, and they actually look at body fat, they look at visceral fat, they do muscle mass, they even compare your right side to your left side, and they do bone density. But it does give you some nice information if you ever wanted to get one, work on diet, and then check another one to say, how did I do? Did all those things that I wanted to get smaller? Did I lose any muscle mass? And you could imagine if you went from let's just say 300 pounds down to 150 pounds, you would certainly lose some lean mass because you don't need as much lean mass to support half of the weight. But what you're looking for is body fat percent. That's a good, or lean body mass percent. Bioimpedance scales are very common, popular. They're readily available. You can get, there's a number of different ones. That there's very expensive and accurate ones at the Metabolic Health Center at Delnor. And we have some lower level but good quality ones in our office and in the occupational therapy office with our SOZO machine. So if anybody gets a lymphedema test, there is a page that we can show you your lean mass and your body fat percent. But I always say that that's why it's a better idea to use measurements and how clothes fit than your actual scale. Because if you're losing body fat, you're going to lose weight. But what if you're gaining lean mass? And I always like these pictures because they're showing women who are weighing the exact same, but they have significantly changed their body composition. And I don't think any of us would mind being the same weight if we were able to significantly improve that body composition. We'd all wouldn't be too worried about an extra 10 or 15 pounds if it was all lean mass. This was a randomized controlled trial called the Medex. It actually had a very long name, but it was the Medex outpatient trial. And it compared two different types of exercise. So it looked at a high intensity resistance with impact training versus a low intensity, it was actually a Pilates type exercise called Buff Bones. So it was a low intensity Pilates versus a high intensity resistance training. And then they also looked at them either alone or in patients who were already using a bone strengthening medication. They looked at the fracture risk. So they looked at bone mass, they looked at body composition, they looked at muscle strength, functional performance. They also looked at compliance and safety. And they found that high intensity resistance impact training was better than the low intensity Pilates-based exercise program for enhancing bone mass, for improving muscle strength, for functional performance, and for stature. The low intensity program did improve function, but to a lesser extent. Of the 115 participants, most of them, 86 of them, were not taking any osteoporosis medications, but for the 29 women who were already taking it, it appeared that there was a complementary effect, that the medication seemed to enhance the effect of the exercise more. So I'm a big proponent, I know many of you know that I'm a big proponent of high intensity interval training and weightlifting. Another study that showed it. This was an interesting, just a review looking at hyperinsulinemia and what's called osteofragilitas. So basically that's bone fragility in the setting of hyperinsulinemia. So what they saw was that bone fragility, which leads to an increased risk of low energy fractures, meaning fractures in situations where you wouldn't normally expect a fracture. Obviously, if you were in a car accident or a big fall, you would expect a fracture, but sometimes, you just turned wrong or you just barely tripped over something and you broke something. That would be a low energy fracture. And this was independent of bone density and occurred in patients both with detected and undetected hyperinsulinemia. And what they found was that carbohydrate restriction or fasting or ketosis increases, we know, beta oxidation, ketolysis, which is the breakdown of ketones, and NAD positive dependent antioxidant activity. So again, just some antioxidants, but also the osteocyte viability and osteocalcin. Osteocalcin is what calcifies the osteo or the bone. So, and then it decreases excess insulin exposure. So we're just talking about how high insulin may lead to these fragility fractures. And when you are in a carbohydrate restriction diet or ketogenic diet, you are actually increasing your bone strengthening tissues or enzymes. So osteocalcin is required for hydroxyapatite alignment, conferring bone structural integrity, decreasing fracture risk, and also improving metabolic and endocrine hemodynamics. So patients presenting with fractures but normal bone mineral density, they're recommending should actually be looked at for high insulin levels. So if we don't know why they fractured, we should actually look. They're probably in that hyperinsulinemic, pre-diabetic, type 2 diabetic spectrum. So if I can take us back to that unsaturated fat and COVID-19 article, what do I see as a benefit of a ketogenic diet? Well, saturated fat was protective, and we know that we can increase saturated fat with animal foods, animal fats, and dairy fats like cheese, butter, and also with coconut oil or coconut butter. Calcium was protective. We can increase calcium with high-fat dairy intake. Also, taking a vitamin D supplement can also increase the calcium that you absorb from your foods. There's also calcium in the green leafies, which are common in a ketogenic diet. Albumin is protective, and you can increase your albumin by increasing your protein intake. So the most common way to improve it naturally would be to make sure you're getting adequate protein at every meal. So eating a ketogenic diet should be very protective from a COVID standpoint. This is another recent study. This just came out last month, or in August, 2 months ago. Red meat, comparing it or looking at it in overweight and obesity. So systematic review and meta-analysis of observed studies. And what they found was that red meat consumption was not associated with weight. And that was basically the p-values were not statistically significant. So anybody that says red meat causes weight gain, that is incorrect. Certainly anybody who's eating a lot of red meat from, McDonald's and pairing it with buns and French fries that are soaked in soybean oil and a Coca-Cola that's filled with, high fructose corn syrup, absolutely, but I wouldn't blame the red meat. This was another recent study. 55 studies were included in a review looking at dairy consumption and cardiovascular risk. And what they found was that total dairy consumption was actually associated with a lower risk of hypertension, coronary heart disease, and stroke. And I always feel like I'm fighting a little bit of the perpetuated myths, but we always hear about nutrient density. I like to talk about nutrient density, but are fruits and vegetables actually the best sources of vitamins and minerals? Do we have to eat the rainbow? If we look at various food sources, if we look at beef and liver, they are far more nutrient dense. They win. Yellow would be the first place. Blue is the second place when we compare it to the same weight. So it's in weight of apples, blueberries, bananas, kale, beef, or liver. And you can see that liver kind of wins hands down. Beef, very close second. Kale, but 100 grams of kale compared to 100 grams of beef, you might have to eat quite a bit of kale. When we look at just a basic vitamin, so this does not have the minerals on it, it has the B vitamins, C, A, E, K, and D. You can see that the majority of the foods that are listed are meat, liver, eggs, dairy, as well as leafy greens, above ground vegetables. There are a few fruits on here which may or may not be able to be included. You might be able to do small amounts. But if you stuck to the basic low carbohydrate meal plan, you would hit all of these vitamins quite well. This was a study that was actually looking at micronutrient gaps during a feeding period in South Asia. And what is shown in the table is the portion size. So how many grams of each of those products to get an average of 33% of the requirements for iron, vitamin A, zinc, folate, B12, and calcium. And you can see that if you were eating beef liver, you only needed 1 gram, chicken liver, 3 grams, ruminant meat. So ruminant meat would be red meats or grass feeding animals like beef, lamb, venison, buffalo. Those would be ruminant type meats. So that's only 28 grams. Small fish, 32 grams. That would include things like salmon, mackerel, sardines, eggs, leafy greens, chicken. So up to this point, we've only talked about low carbohydrate foods. When we get to milk, we could say, well, could we replace milk with dairy? What about sour cream or cream cheese or a full fat unflavored yogurt? Then we get to ground nuts, still considered a low carbohydrate food, although again, we're starting to go up in the amount of grams we need to get an adequate. And then we get to pulses, which are the root vegetables. And you can imagine that when we get to the other ones, they do start to, you need more and more and more of other things. So if we just stuck to the upper 5 or 6 things, we'd actually not need a ton of food to get really good nutrient density. So the 12 most nutrient dense foods are actually all low carbohydrate. Usually some of them are high fat, others are not high fat, but we can add fat to them. And I always say just because it's listed in the nutrition facts doesn't necessarily mean you absorb it. And I think zinc, I think with this whole COVID thing, we've heard a lot about zinc and zinc deficiencies and taking zinc to protect you. And one of the reasons I think that's such an issue is because many people are eating lots of grains and legumes. And you can see if you ate an oyster, 120 grams of oysters, you get a pretty decent zinc absorption. This is a test that was tested every hour on the hour. But if you ate the same amount of oysters with black beans, you got far less of the absorption. And if you ate it with corn tortillas, you really got no absorption. So again, just because we think it's in that food combinations can matter. And I don't think that we really know. So again, I usually have people hold the beans and the tortillas because those are foods that can have other issues as well. And they also are high carbohydrate and can cause glucose and insulin dysregulation. And all protein is not created equal. When we look at beef versus beans, even though they may start out roughly the same amount of grams of protein, maybe in a diet tracker, we have to think about how easily are they digested, how much of the protein is digested, how much of it can we actually use. So there are these tables that are given for biologic values. So basically how much is digested and then how much are you actually going to get of what you ate, how much is usable. So when we started with 21 to 22 grams of each, we ended up with 14 grams and 5 grams. So we got almost 3 times the amount of usable protein when we ate meat versus beans. So again, I will always advocate for animal proteins. What about people who tell me they just don't like meat, but mainly because they don't feel like they digest it well, or it just sits in their stomach. It just doesn't do very well. Interestingly, it's usually because there's a low stomach acid. Maybe they've been on proton pump inhibitors or other types of stomach medicines for a long time and have actually slowly suppressed their acid production. Maybe there's other reasons for that. Maybe we need to basically acidify the gastric juices to help digest foods, and there are some over-the-counter and natural ways to do that to help improve digestion. Sometimes it's just starting with more easily digested meats and slowly adding in a little bit. But I will say that I do think meat is a superfood. And then finally, I wanted to just throw out, if anybody's interested, this weekend there's a 3-day virtual symposium. It's actually on lymphedema, which is abnormal fatty accumulation, or lymphedema, which some of you may be familiar with, which is swelling of the extremity because of lymphatic flow differences. And that I'm actually one of the speakers. It's a lot on ketogenic diets because one of the symposium directors has actually written 2 books on ketogenic diets for these lymphatic and fat disorders. There is the link there, so if anybody wanted to sign up, they are welcome. And that's all I have for tonight. So we'll see you next month, November 17th, and we can go ahead and stop recording.